Hi, I'm Dr. Sten Ekberg with Wellness for Life, where we do nutritionally and neurologically based chiropractic and healthcare. And I just ran into someone who was bedridden after a medical event. He went in for some routine surgery and he had back pain for many years. He had been on steroids for 6 years, which had made his skeleton very fragile. So when they went to turn him, they fractured his L4 low back vertebra. And then when they said that they had to go in and fix it, they figured, oh, let's just fuse the whole spine while we're at it, since it's so unstable. And then he ended up with a C. diff infection and 3 months in hospital on intravenous antibiotics and so on. But what I wanted to address, other than that sad story, is that before we go and have spinal procedures and spinal fusion, we want to ask ourselves, what is the function of the spine? Because most people think it's just a bony column there to provide a little mobility and protect the spinal cord. But the physiology of the spine is incredibly complex. And one of the main functions of the spine is to feed the brain, because the movement of joints provides signals for the brain. So just like you exercise a muscle, the muscle gets stronger. If you break your arm and you don't move the arm at all for a couple of months, then the arm atrophies and there's virtually no muscle left. Well, the same thing happens to the brain. When we don't get the proper signals to the brain atrophies. It is less capable of managing homeostasis and all the vital functions of the body. When the frontal lobe goes down, we lose digestion, we lose concentration, we get depressed, etc., etc. So when you fuse the whole spine, you are robbing the brain of vital nutrients in the form of information. So again, we as a society, it's time that we start understanding the holistic nature of the body, that you can't treat it as parts. You need to understand how all the different parts work and interact in a holistic manner. That's the only way that we're going to be able to have health instead of just doing little symptomatic interventions. So that's all for today. It occurred to me I wanted to share that story. So that's it for now. Thank you very much.